Well, good afternoon, everyone. Thank you so much for joining us again for our second installment of our Prepared to Support Women and Their Sexual Health webinar series. To start, I would like to introduce Leisha McKinley-Beach. Leisha is founder and CEO of Cush Health Impact and Leisha.org. Mrs. McKinley-Beach also serves as a consultant who provides training and community engagement on HIV and other health issues that affect Black communities, specifically Black women. So, Ms. McKinley-Beach, the floor is yours. Thank you so much.
Thank you, Jennifer. It is truly an honor to be here for round 2. And you won't hear from me that much because these 3 dynamic women we have today, they need all 60 minutes. And so I am so excited to have them. But I know them, but I want to make sure that you get a chance to know them as well. So let me just do a quick introduction of these fabulous women, and we're going to go ahead and get started. Miss McCall Christensen is a harm reductionist, a program manager, and a health educator specializing in infectious disease prevention and substance use disorders. With almost 20 years of experience in public health, which means they had to recruit her straight out of elementary school. She has clinical care and firsthand community perspective. She offers a very unique subject matter expertise in the intersection of HIV, hepatitis C, and substance use. So please help me welcome Ms. McCall Christensen. Next up, we have Ms. Larisa Niles-Carnes. Larisa is the program manager at Grady Health System in Atlanta, Georgia. She provides oversight for the PrEP program. She has worked in the field of sexuality and HIV for the last 17 years. She too got recruited from elementary school, but she has had this passion for HIV prevention since the age of 11. And so if I don't ask her audience, put in the chat feature to remind me. Let's talk to her about that passion that started at such a young age. Before working with the PrEP program, Larisa worked with those living with HIV for 5 years, assisting with patient navigation program and the patient navigation program and providing support for retention and care efforts. And then last but not least, a young lady that when I met her, she was just Brittany, not Britney Spears, but Brittany Williams. And now it's my distinct honor to introduce her to our audience as Dr. Brittany Williams. Dr. Williams has received her doctorate degree from the University of Georgia. Before that, she received her master's degree from the Teachers College, Columbia University. She is currently serving as a researcher and assistant professor at St. Cloud State University. Now, when I had the honor of meeting Brittany, she was serving as a spokesperson with the Georgia Department of Public Health Ladies Who PrEP tour. And she's also been a plenary speaker for the United States Conference on HIV and AIDS. So please, please help me welcome our very distinguished Ladies Who PrEP on today. Now, ladies, I know y'all had to know that this was going to be the first question coming out of the gate. Why PrEP? Could have chosen any prevention strategy. Why PrEP? I'm gonna ask all of you. So
no, we all unmuted at the same time.
Exactly, yeah.
Yeah. I'll go first. So for me, it was why not, right? I'm gorgeous. I love sex. I like people who like gorgeous women who like to have sex. So I want to be as safe as possible, right? We take birth control in order to avoid unwanted pregnancies.
There are all of these things that we do related to sex that make sense. We use condoms in order to protect ourselves. We get tested in order to make sure we know what our status is. So why not add PrEP as an added layer of safety and comfort, and something that I can do on my own to make sure I'm taking my HIV prevention wellness into account. I can't trust anyone else with that more than I trust myself.
Yeah, I echo that. It's just a prevention method that I can solely rely on myself to be able to make sure that my health is taken care of. I don't have to have that conversation about condoms and have to bicker back and forth or rely on someone to take their medication. It just helps me make sure that I'm doing all I can to keep myself healthy.
Mm-hmm. And I will also echo McCall and Dr. Britt's sentiments that they have with using PrEP. For me, it's also very much an empowerment tool. I am very big into doing things that are empowering for myself in all kinds of facets of my life. So for me, it's been very empowering, both sexually and personally. And this also ties into answering my question about being involved with HIV related stuff. Since I was 11, I grew up with quite a few people that I knew who had HIV. And so for me, it is also a tribute, if you will, that they did not have life-saving medication available to them at that time. So it almost feels like I'm paying tribute to my ancestors who have passed from living with HIV. And it's a way to show them that now that there's prevention out there. A lot of people don't know that PrEP exists. So I can be a leader and I can be a speaker for those that are working on trying to prevent HIV.
And Lareesa, can I tell you, I'm so glad we're recording this because you're going to hear me use that statement again, because oftentimes people say, oh, well, are we just promoting a drug for people to use? And to look at it from a human perspective of, you know what? I am privileged to have something that people before me did not have. And I got to make the choice. It was my decision to use this as a prevention strategy. I love it. Now, let's talk about how you found out about PrEP. Now, we know we see the commercials now, and on those commercials, the general PrEP commercial, the Descovy commercials, we know we don't see people who look like you. So how did you find out about PrEP?
I can go first since I'm unmuted. So I found out about PrEP in 2012 when it was first approved. I was at a national HIV conference in Washington, DC, and there was quite a few plenary sessions on what PEP and PrEP was. And so that's when I initially in 2012 started hearing about PrEP and PEP. And it wasn't until 2016 that I actually started taking PrEP. Just being in the field for as long as I've been in the field, it took a long time to figure out how to navigate how I would get on PrEP.
Yeah, I probably heard about it about the same time, 2012, and then really started paying attention to it when I was working at Utah AIDS Foundation around 2013, trying to navigate the system and providers on who will offer it for the people who want it. So, and that took quite a while to figure out. And so I started taking PrEP in 2017. And at that time, it was really one provider that was out doing it at that time, that was known at least.
I guess I'm late to the game, which makes sense, right? I wasn't doing any type of HIV work or research, which now I'm trying to. So I learned about PrEP in 2015 or 16 from one of my friends who worked in Washington, DC on some HIV prevention and reduction policy, and who also happened to be a Black gay man. And so he was explaining to me that this is something that had been talked about in communities, particularly queer communities, where folks are trying to minimize their exposure risk to HIV, but that it wasn't limited to men only. And at that time, I didn't know any women who were on PrEP. So I spent about a year and a half doing some research, talking to some of my homegirls about it, We had our little sister circles, and I'm like, all right, I learned about this thing. Let's do some research. We're all PhD students. Let's find out what's the what and who's the who, so we can figure out if this is something we want to use. And in 2018, I was dating someone, or two somebodies in 2018, who were both HIV positive. And so while their viral loads were suppressed and they were taking their medication, and I trusted they were taking their medication, I don't trust nobody as much as I trust myself. So I went to my doctor and asked for a PrEP prescription because I had been doing research. Now I'm in this relationship that's serodiscorded, and I wanted to make sure I was doing everything that I could to make sure I was safe. So that's how I heard about it, initially from those friends, then talking to my girls, and now I've become the unofficial straight woman PrEP ambassador that I know.
Yes, and we're so grateful that you are the official straight woman PrEP ambassador. But Brittany, I wanna come to you for just a moment, because you have a very unique story about how just hearing about it and wanting it was not that simple. And if you could share with our audience the advocacy as somebody who wasn't our HIV workforce, what all you had to go through to get PrEP.
Absolutely. So at the time, I was a student at the University of Georgia. I had student health insurance. And so I went to our health center. I was in the women's clinic for my annual exam, STD testing, all of the regular things that I always do. And then I said, hey, I want to be on PrEP. I'm dating this person. We're about to have sex, I think. I want to make sure I'm okay. And they were like, well, what's that? And then after 30 minutes of explaining what PrEP is to an actual medical provider, which annoyed me because I'm a student and I'm trying to write my dissertation, I don't have time for this. Then it went from what is that to, well, we don't do that here. And I was like, okay, well, why not? And what is here? Do you mean the whole medical center, the whole university, just this office? Like, what's happening here? So eventually I was referred to, at that time, the one Black woman doctor who worked for our university health center and who had been prescribing PrEP specifically to Black and Latino men on campus. But there had not been, they knew, a woman who had went in and asked for PrEP before me and who had pushed for it. And so while I was in that women's center women's health center, and specifically having that exam and telling them why I wanted to be on it, they kept trying to talk me out of it. I felt like my health provider was like, oh, do you need this? Can't you just use condoms? Can't you do this? Can't you do that? And I'm just like, girl, I got health insurance and I got money. Not a lot, but I make a few peanuts. Why are you so hesitant to give me this prescription? And so I stayed there until, at that time, I think the health center closed at 4 or 4:30. And I was like, I'm not leaving until you give me this. And so part of it was the advocacy skills that I developed as a graduate student and as someone who's an educator over here, that I had to take and then leverage against these health practitioners on my own campus, because the women who were serving me in the women's health center could not understand why I wanted to be on PrEP. And to me, I felt like that was ridiculous. One, because Georgia's HIV rate is astronomical. Two, UGA is down the street from Atlanta. Three, we go to Atlanta to have sex. So what is happening here? And why wouldn't you just write me this prescription? And so it's not just, I have found in my experience, it has not been as simple as saying, I want to be on PrEP, give me a prescription, but there has to be some education and some advocacy if you don't go to health providers who know about PrEP and who care to put you on it.
Thank you for sharing that, because I know that so many of the folks who are in the audience, they serve college students. They work in partnership with colleges and universities. And to hear your experience, sounds like there's still some action within our workforce we gotta take to make sure that college students, especially women, aren't having to jump through so many hurdles to access PrEP. Now, there's a question that has come in the Q&A, so I'm gonna shift gears for a minute, and I wanna ask this question to the group. Did you face additional stigma being a woman pursuing PrEP care? And so, Brittany, we heard part of your story, but Lareesa and McCall, I'd like to hear from you.
Absolutely, I did. They did not know who they were talking to, so they quickly got corrected. But basically, for me, what happened was I've had a couple different instances of stigma related to being on PrEP. My first instance was when I went in for my annual exam. I was already on PrEP through a research project. So that's how I got access to it. And so I was telling them what medication I was on, and the person doing my intake, not my OBGYN, but the person doing my intake, she was like, okay, so tell me a little bit about, because you're on PrEP. So are you married, or what I like to say to my son, living in sin? And I said, happily and consensually living in sin with protection. And that
she wasn't ready for you.
She wasn't ready. So I gathered her a little bit. But that was one of my experiences. Another experience I had was going to a different, I had another kind of follow-up appointment elsewhere. And I told them what medications I was on. And then they asked me why I was taking PrEP. And I said, well, it's empowerment, but also, you know, I've been in a serodiscordant relationship before. And then she was like, well, are you really protected? And then when I started educating her about what PrEP was, and she goes, well, I guess you would know more than I would. And I said, well, yes, that's a scenario. But then also too, they put a note in my chart, and I don't think they realized I could see this. They put a note in my chart that my partner at the time was living with HIV, and my partner would come to those appointments with me. So then they were disclosing my partner's status to whoever else had access to my chart. So I had to have them remove it. So it was really interesting, just them, I think, putting information in my records that they didn't need to know, or just putting in their 2 cents about how I was protecting myself and what they really thought about that.
Wow, I wish I could have been a fly on the wall and saw that jaw drop when you were, yes, I'm living in sin and I'm protecting myself through it. Now what? What else you gotta ask? All right, McCall, what about you?
I of course experienced stigma. I went through probably, I think, 3 providers the first year I was on PrEP. The first one, the first appointment I had, actually, the provider made a weird comment about how thin I was when he was doing my physical. And then at the end of the appointment, because in Utah, in Salt Lake City particularly, we have syphilis related to MSM population, lots of syphilis cases. And he ended the appointment saying, and if you get syphilis, I'll kill you, or something like that. And I was just like, I'm not sure what that means, because I'm with someone who is HIV positive, automatically means that he's going to give me syphilis. And so he then, after that, referred me to a couple PAs that I kind of rotated through. And it just never like a great experience. I mean, in Utah, only less than 3% of PrEP users are women. And so they just have a really, really hard time navigating that for some reason. And so I went to my primary care provider, and she's great. And I just asked her, I just said, are you interested in prescribing me PrEP? And we just went from there, and it was a great relationship.
So it's interesting to hear from the 3 of you of your experiences. I mean, it sounds like that throughout the process, you found some providers who were knowledgeable. Some providers you had to increase knowledge before that they could give you what you needed. And other providers, you had to check their stigmatizing comments and lack of client-centered approach to be able to access PrEP. McCall, I want to stay with you for just a second. There's a question that came in the chat feature that says, can you speak to PrEP and effectiveness related to drug use? And how can we better market PrEP and other sexual health services and SSPs and drug user health services?
I think that this is an ongoing discussion, and definitely within the community, that they should be part of the conversation and part of the dialogue and offered the services. I do think that, I mean, based on, I mean, when you say drug use, there's so many different levels of drug use and people being able to make the appointment. I think a 3-month checkup is difficult for many people in general, let alone maybe someone who would have to take the afternoon off or the morning off from working and have to go and sorry, I'm losing my voice, I have a cold. Have to go to their appointment every 3 months. It's a huge gap and in the system, because it's removing possible income for the day so that they can have their room. And it's just, it's a hard population to get medication, a regular medication with on a daily basis. But I don't think that it is impossible. I think we just have to kind of reframe what is required of it, you know, to access the PrEP. So, I mean, we definitely know that women engage in sex work. We engage in, we have sex with men who have sex with men, and we use drugs. And so it's just, we fit all the risk factors, quote unquote. And it's just, we just need to better dialogue about it and educate. Many people don't even know PrEP is a thing. So I just, especially within the community. So
anyone else have a comment around PrEP use or PrEP promotion and drug user health services or substance abuse treatment facilities? Anything anyone else would like to add? Okay. Now I want to ask a knowledge question here, because I hear this from some women about their process to get to PrEP actually started with the need for PEP, post-exposure prophylaxis, and then from there they were offered PrEP. Was that a part of any of your stories about starting with PEP first and then transitioning to PrEP?
no, for me, I haven't taken PEP, but in our area, PEP still isn't a really easy thing to access. It's still hard to navigate. You go to the ER hoping someone will prescribe it. And so no, I haven't had that experience personally, but I know many people who have.
And McCall, can I say, it's not just your area. Many women talk about the difficulty of trying to access PEP and the short time period that you have. You want it to be as smooth as possible.
Mhm.
But I bet you somebody on this webinar can speak to that, Miss Lareesa. I'm going off track for just a minute, and you could just highlight what your program is doing for women who need PEP and may transition to PrEP.
Yeah, so we offer PEP and PrEP at Grady. Our emergency room offers PrEP and, well, I'm sorry, they offer PEP. But generally what I encourage is if they call during business hours, like our business hours being on Eastern time, 8 to 5, that we are able to get them on PEP. They can come in same day. They can bypass going through the emergency room. So they can bypass a 4 or 5 hour wait, and they can leave with their PEP the same day, generally within about an hour, hour and a half, as long as it's not part of an assault case. If it was a forced assault or something like that, we will encourage them to go to the emergency room, just because they'll meet with a sane crisis, rape crisis counselor and nurse and all of that. But if it's just somebody who has had a condom break, somebody didn't use a condom, they removed the condom during sex, whatever it may be, then they can contact us at 404-616-PrEP here in Atlanta, Georgia, and we'll get them PEP the same day, and they can walk out regardless of insurance status.
And thank you for sharing that. And of course, every time I have you, I always ask you to share that, because so many people don't know where they can access PEP from in Metro Atlanta. Even more importantly, as somebody who is a member of our HIV workforce, I didn't know where to send women without them having to jump through all these hoops and hurdles trying to access PEP. So you guys got a lot of questions coming in the Q&A. I'm gonna shift for a minute. I made a commitment to our audience. I wasn't gonna say this for last, and you know, they get the last 5 minutes. So let's answer a few of their questions. One of their participants has asked, how often are you being tested for HIV or STIs?
I can start with that one. So I definitely
Okay.
get tested every 3 months when they test the function of my kidneys and my body and my liver and making sure everything's copacetic because I'm on PrEP. I've been very lucky. I've had almost no side effects. So there's every 3 months. And then anytime I have a new sexual partner, I get tested 3 weeks after we have sex because that's just my mental health. I don't care what my insurance company thinks. My doctor knows that I don't care what she thinks. I have insurance in this country. Insurance is hard to come by. I'm going to use it. And so I go whenever even if it's, just I met this person, we had sex once and I'm never going to see them again. 3 weeks later, I'm in my primary care doctor's office and she's like, well, do you want to be tested for something specific? Do you have symptoms? No, ma'am. Exactly. Hashtag use my insurance. Please give me a test for everything. And I do mean everything. And I sit and I watch them take my vials of blood and do my swabbing, whatever, because I need the peace of mind to know that my health and my health status is in my hands. Like the most that I can do is frequent testing plus what I'm already doing. But that's just me. I'm a little bit of I don't know. I just like to plan and be in control as much as possible.
Absolutely. And that's so empowering.
And my situation is very similar to Dr. Brittany's. My provider and I have a really good relationship. She knows I work in HIV, so she knows that I am a little more, ahead of the game and knowing what's going on. So she puts in standing orders for me. So all I need to do is get tested every 3 months. If I want to get tested sooner, if I have a partner change or whatever that looks like, I just drop her a message in our patient portal and she puts that in. So it's nice that I'm really good about, she's really good about letting me have that autonomy. And I'm also really good about having advocacy for myself and empowerment. And I think that's also really important. I think empowerment is really important for anybody, but especially women, because oftentimes we're getting judged for being sexual beings and for enjoying sex and for having one partner, having a million partners, whatever. So I think being able to be your biggest advocate for yourself, regardless of how somebody might talk to you afterwards, because you can always check them and let them know.
And clearly we know that you don't have a problem doing that, Lareesa. McCall?
I as well test every 3 months. And when I have a new partner as well after or before, whatever we decide how we want to do it. And once again, I have a great provider as well. And she knows I know my body and know what I need to be able to stay healthy. And she is there to assist. So it's been great.
And Brittany, you started the conversation around side effects, that you virtually haven't had any side effects. Lareesa or McCall, any side effects that you feel comfortable sharing with the group, if any?
I hadn't had any. It was smooth sailing for me. I was lucky for sure.
Yeah, basically the same for me. Every now and then, like if there's a period where there's been a couple times where I've gone off PrEP for maybe like a month or so for whatever reason. Sometimes when I've restarted PrEP, I've had like maybe some stomach cramp in the very beginning, but then it goes away really quickly. So I really haven't had any issues whatsoever.
Okay. And I'm glad that you mentioned that there may be times that you go off PrEP. And I was having this conversation with a women's coalition last week about how we are framing the success of PrEP for women. And there's a recommendation that came out of the group that I'd like to ask your feedback on, which is, it is not a failure if a woman has one prescription for PrEP. that she might need PrEP for that season. And so we need to be looking at season of need versus ongoing prescriptions for PrEP. What are your thoughts about that?
I'll go since I'm off mute as well. I think people should do what is going to be best for them. Me personally, even if I'm not sexually active, I'm going to stay on PrEP. To me, it's a prevention. I'm all about, public health prevention, because I don't know what could happen. I don't know if I could beat somebody and that's what I decide to do that night, or if something else happens and it's a forced situation. And it's also just part of my routine, so I take mine every night at 10 o'clock before I go to bed. So it's part of brushing my teeth, it's part of washing my face, and then I take my PrEP and then I turn off the lights and go to bed. So for me, I'm a creature of habit, and I'm type A, so everything for me is routine. So regardless of my sexual encounters or whatever may happen, I'm still going to take it.
I think seasons of need is not a terrible idea. I think everybody's situation is different. And some people, like I said, the 3-month checkups can be a lot for people. So if they're not in a situation that they are really needing to be on PrEP or wanting to be on PrEP at that point, then they might skip it for a little bit. And I think that's okay. I think that's all right.
Now, there's another question for you all in the Q&A about, were your health departments effective or supportive in action? Let me ask it the way that they wrote it. Was your local health department of the assistance with PrEP at the time you were making your decisions?
So I'll answer this, but it's sort of a non-answer a little bit. I now know about all of the wonderful things the Fulton DeKalb Health Authority and Grady Hospital are doing for PrEP and PEP, but I learned about it after I finally got my own prescription 70 miles away, and I had to advocate for it. And so I think for me, part of it was a catch-22 of not even knowing, one, that I probably could have gone here. I was living with my parents at the time in Atlanta to get my prescription, even though I was a student, 80 miles away and supposed to be living on campus and whatever else, right? But I didn't have any idea. But because my health insurance was tied to our student center, that's where I went. And that's where I asked for support. And so I think part of this is about messaging campaigns and about additional information getting out, because to me, I don't necessarily, I hate the language of high risk. I think anyone who is engaging in sex is high risk, right? All sex comes with risk. And so I wonder if part of what's happening is, even if there's a health department program that's doing amazing work, they're only targeting folks who are considered high risk and not other people who might be interested in getting on PrEP or learning about PrEP or trying to get a PrEP prescription.
I think our local health department, they do great work. But at the time I was starting to access, it was very, very MSM focused. Really didn't suggest PrEP for women unless their husband tested positive at that time and then suggested PrEP, at least from my experience. But they do now offer PrEP at the health department, so that's a good step. But yeah, it's very, very MSM focused.
And I'm gonna go off script. I'm gonna be so far off script, I'm not even in the book with this comment. McCall, you were in Utah. Larisa, you're in Atlanta. And Brittany, you all over the country. But the stories are exactly the same. From the commercials and awareness, they don't focus on women, to women have to be knowledgeable and go in and ask for it because providers aren't freely offering it. So we can't say this is just a Southern issue or Midwest issue. It's an issue for women all over the country. So where do we start? Right? So literally, where do we start in terms of whether it's education for healthcare providers, if it's marketing and awareness. I just give us some words of wisdom. How do we start addressing some of these challenges women are facing?
Well, I think having the funding for health departments and community-based organizations be focused strictly on MSM is where the dialogue needs to start. Just because for people to stay afloat and get their money, they need to meet those grant deliverables, and that's where it's at right now.
So funding be more inclusive
Right.
of women in PrEP issue, okay?
Yes.
I also would echo that, but also include that providers need to make this more part of their regular questioning. I think that a lot of times providers get very bogged down with what's required of them to ask, you know, about safety in the house or this, that, and the other, but they also need to ask about protection and not worry about what they think the reaction will be. So many times I hear providers say, I don't have time to ask those questions, or I don't want the patient to think that I'm trying to say something about them. And it's all about how they're delivering those questions and how they're framing those questions. Providers need to be really comfortable talking about sex, because the more comfortable they are talking about sex, the more likely their patients are going to feel comfortable sharing things that may or may not be normal for them and advocating for themselves.
I would add to that, I feel like there's not enough passive programming about PrEP and women. The example I always use is when I go into the doctor's office and there's something about birth control, or have you done this lately, or whatever the question might be in some of the advertisements they use. I always ask for whatever it is on the thing, because I probably didn't go in there thinking about it, but now I've seen it and I am. And so part of it is, are we putting women who look like us? Are we putting everyday women, and not insert model here who's in the commercial, who's not actually an active PrEP user? Are we putting people who are actively, and women specifically, who are actively using PrEP in the ads? Are we putting a blurb about their experiences, right? And I don't know that would actually cost that much more than what we're already doing. So for me, I agree with funding, but spend the money.
There's a question in the chat. I really want to highlight this one to get your thoughts on this. And this is going to go back to a question that we had prepared about the terminology. So one of our participants says, I work with a local health district. We have sexual health clinics, a Ryan White HIV program, and family planning. We have and offer and advocate for both PEP and PrEP. I get great resistance from the women I offer PrEP, even though they acknowledge their risk. Any suggestions? Now that's a good one right there. Any suggestions, panelists?
I just think education, number one, is the key, like specifically geared towards women. I mean, it's just hammered in our brains for so long, especially if you're not in this line of work, that it is not something that women really have to worry about. And really, women aren't supposed to enjoy sex, have sex. And so bring it up, and can be a delicate, touchy subject. And it's just, I think the approach is key there, and also repeating, and having it available every time people come in, and having that talk is how you break down those barriers.
And I'd also add, when people are interested in talking about PEP and PrEP, sometimes it might take a little while, but going over the pros and cons of why to take PEP and why to take PrEP. Oftentimes we have patients that are prescribed PEP, and I call and follow up to make sure that they didn't have any issues getting their medication. They're like, oh, I changed my mind. I think I'm just overreacting. And I think as women, we often are taught that we overreact. So I think that having that phone call afterwards and really kind of delving into what are the pros of taking this, what are the cons of taking this, you're being proactive by taking this, you know, you're empowering yourself by taking this. So just really kind of changing the messaging and not so much validating that they may be feeling that they're overreacting, but validating the feelings that they may have, and then helping them come to that decision on what works best for them. Sometimes I think we just have to take a little bit more extra time, regardless of whatever numbers we're trying to hit for our metrics, and really make sure that people are feeling empowered to make the best decision for themselves.
And so what I'd like to do at this point, since that question came up, so thank you to our participant for that, is I want to ask this question about risk, but I also want to give you a couple of words, and I'd like to know your thoughts about this. Oftentimes when we focus on risk, that might have a negative connotation for folks, right? So now you're saying my sexual life is put on display, and I'm sitting across from you, and you are telling me that my sex life is risk. That, you know, sometimes that's very hard to digest. And I'm thinking all these years I use that term, I never thought about it that way. But then when you think about it from a personal perspective, that's really what we're saying. So if we were removing the term risk to help women across the spectrum, not just women who are single, or women you know, who may have multiple partners, but also women who may have a marital status as married, as if that is a protection against HIV, but that's going to be for the 4th session with the STD directors. But across the spectrum, what would we, if we weren't using the term risk, what would you replace it with? What would you replace risk with?
I don't know necessarily what I would replace risk with when when I'm talking to participants in my program. It's just educating about transmission, and then allowing them to apply that education to their situation and see what makes most sense to them is the approach I take.
All right, so I'm gonna read you a few statements or words that I've collected from women this year, and tell me what you think about these as a replacement of risk. One of the words was, or phrases, was season of need. What's your thought on that one?
I don't mind the word season of, or the phrase season of need. I think that there's different times in my personal life that I can say that I may not have always known what my partner was up to. So in my time, that would probably be my season of need, knowing that I needed to protect myself at that moment. Okay. Extra protect myself.
Okay. I'm hearing from DC, we use season of pleasure. Michael, you are a step ahead of me. I was getting to pleasure, but I'm gonna start with yours, season of pleasure. What do you think about that term?
I like it. I mean, I like any phrase that doesn't necessarily scare people, but I also don't want to undermine the potential risk, right, to use the word, associated with HIV transmission. And so for me, I talk about it in terms of potential exposure is usually what I say to folks. I know what I'm doing. I like the person I'm seeing. they may not be as honest as I am. I'm a little bit too forthcoming, probably. Y'all know way too much about my life, right? In my opening sentence. And so I think for me, exposure rather than risk or potential for exposure always comes up as a better way to say it.
And we have a participant who agrees with you. They had already placed exposure. What about sexual health assessment?
That sounds uppity.
Too academic.
Okay. What about pleasure assessment?
I think that's implying that all sex is pleasurable for everyone. And that is not necessarily true for many people.
Okay. All right. So another participant says, I have used opportunity for exposure. Brittany, along your lines about exposure. Someone else said, I like potential exposure. Okay. So in just those few minutes that we were responding to that question, we were able to come up with some alternatives to risk. And so as a workforce, I would encourage us to be thinking about, as we're having a conversation with women about PrEP, how we're framing it to center them. And so there's not a focus on stigma or judgment because this is a need for the strategy versus let me make sure that you are informed. And if with that information, you've made a decision, this is what you want to do, we'll move forward. Absolutely. Boy, you guys got a lot of questions coming in the Q&A. I do have to ask this one because there's several questions related to insurance. And so questions around, were there any challenges with your insurance plan in covering PrEP? Or do you find you have issues with your insurance paying for PrEP?
I haven't had any issues. I'm very privileged that I'm able to have good insurance that covers the medication I need. And, but yeah, I know that that's not for everyone's situation. And there is a free PrEP clinic that we do have here in Salt Lake, and they're able to assist a lot of the individuals who meet the income gap and able to get it covered. So that's really helpful. So, however, I was just talking to one of the providers, a friend of mine who is a resident right now, and he was just saying that he admitted that if a woman comes into access PrEP, that he has absolutely no idea where to start assessing the need, which is very interesting to me because I'm just like, receptive is receptive is receptive. Like, that's just, you just go from there. Like, don't worry about a vagina, just go from your knowledge. And so, yeah, it's really interesting. I think that's really, really common.
Brittany or Lareesa?
Yeah, I mean, same. I've been lucky to have really good insurance. I actually just got my first, because I don't know why, my first generic prescription that is not actually by Gilead. So I'm supposed to start that, I think, on Friday, but I'm already psychologically at war with myself because it's supposed to be blue. And so I'm even working through that. But I say all of that to say I didn't have any issues, even when it was expensive for me as a student, when I was making peanuts. The copay was $75, but I was able to use the Gilead copay card to cover that difference. So I never pay out of pocket when I was making $20,000 as a graduate student. And so I think even that in and of itself speaks to, if there are folks who are lower income, but who do have health coverage, there are ways around the cost associated with this. And especially now that there are some generic brands available, I think there will be more insurance companies that are inclined to just allow for the prescriptions anyway. I hope. One can dream.
When I first started, my out of pocket was, I think, $10,000, and because of the copay assistance, and I never had to pay anything out of pocket, which was really, really nice.
Mm-hmm. You have another question. It says, what do you think about the new PrEP guidance that instructs providers to prescribe PrEP to anyone who requests it? Do you think, oh no, do you think this will break the box folks are placed in and help with stigma?
I think one can hope that that would happen. I don't know if, I think that that can help the conversation, because then that takes away the risk conversation. My thoughts are, if somebody's asking for it, then they know why they're asking for it. And then maybe that will help with asking more questions to make sure that the person's safe and, you know, all of those other things. So I think the more neutral we make it, the more likely that more people will take it, assuming that advertising also includes cisgendered women.
Very well said. I couldn't agree more. As we are approaching the hour, don't worry, audience. I'm gonna still try to get in one or two more of your questions. But I do want to ask this question to our panelists. With all that you know and have experienced while on PrEP, would you do it all over again?
Absolutely.
Without a doubt.
110% yes. One of the things that I like to tell people about the reason I started on PrEP was, yes, my safety, and yes, I was going on dates and hanging out with people who were HIV positive, but also my favorite uncle died when I was 4 years old from AIDS, and I was 4, and it is my earliest memory. I don't have memories of preschool. I don't have happy memories of Barney. I literally remember crying at his funeral. And so for me, much like Lareesa, like, why wouldn't I do this? I would do it 100 times over and over and over again, even if it cost me a little bit of money.
Right. So a couple of questions that have come in. This is probably for NCSD. Is there a way to view the first video in the series? Sounds like folks want to have all 3. That is super exciting. So I'll ask a staff from NCSD to respond to that. Where can we find the national data that highlights the national PrEP use and disparities? There are actually 2 resources I would recommend, and for those who have others, please feel free to include in the chat feature. One would be aidsview.org, aidsvu.org. They just came out last week with the 2019 data. Very interesting. I see someone is putting in the CDC breakdown as well. And I'd also recommend AHEAD, AHEAD.hiv.gov. And I'll put that in the chat feature as well. AHEAD is the new dashboard from HHS, and AHEAD stands for America's HIV Epidemic Analysis Dashboard. There's some very interesting data there, and you can run a query just on PrEP and women. Okay. Let me see if I can get in one more question. Thank you to those who included the websites in the chat for us. Let's see here. Someone is in their area, they have an End Stigma in HIV Alliance in San Antonio, and they want to know if you ladies would be interested in being a panelist. And so if you could add your email in the chat, so folks will know how to find you and keep this conversation going across the country. Thank you, NCSD, for having these lovely women on. I think that there's some PrEP connections happening. And there's one other question I was going to try to get to. For those of you questions I wasn't able to get to, please forgive me. As usual, we run out of out of time. I'm wondering if there are any limitations in which you may or may not advocate for prescribing PrEP for women. I thought that was a great one that we needed to try to respond to. Any limitations?
The only thing I can think of would be if there's any types of contraindications, you know, with multiple comorbidities or something like that. That's the only time I can think of it. Even sometimes taking PrEP while pregnant can be a little tricky. And at that point, I would weigh the pros and cons with the person interested in taking PrEP. You know, is their partner virally suppressed? If they're not virally suppressed, then weighing out the pros and cons about the potential patient taking PrEP, because they could take PrEP and prevent HIV transmission or contraction, I should say, but then they have to worry about potentially what that looks like for their unborn child. So I would definitely weigh the pros and cons with them about that.
I would say if it's something that they don't want to do, if they're feeling pressured to get on it, maybe through a partner, then yeah, that's where I would say, don't do it.
I would echo all of that. I don't know that I have any specifics beyond that. But for me, I have a lot of anxiety about the fact that every available PrEP option is not open to folks who have transvaginal sex. So that being cisgender women, of course, and trans men. And so that's frustrating for me. You're limiting my market available options and my ability to take care of myself. So beyond the contraindications and someone being peer pressured or forced into doing something, I can't think of any reason not to give PrEP prescriptions away for free. Stand on the street corner and hand it out.
What would you say to women who are still trying to decide if this is the best option for them? What would you say to them? And before you respond, not Dr. Williams, not Lareesa, the coordinator, not McCall, you know, the coordinator. I just want to hear from Brittany, Lareesa, and McCall. What would you say to women?
I would say we never know what's going to happen. So whatever you can do to best protect yourself and empower yourself for you, that's going to be the best option for you.
And I say, research it. If it's on your mind and you think that it's an option, understand what it is and what your options are, and find a provider that's comfortable and you're able to work with and be able to advocate for yourself during the visits.
I would echo all of that and just say, talk to people, talk it out, talk about it with your friends. If you don't have anyone to talk to me. I've become an unofficial PrEP ambassador on Clubhouse and all of these places, and random people send me Instagram DMs all the time. And if I don't know the answer, I will harass someone that I do know who does this and who is a MD, not a PhD like me, that I can find the answers for. So I say just go for it and keep asking questions. Try it, and if you don't like it, you can always stop.
Mm-hmm.
Well, ladies, we have come to the top of the hour. I knew this was going to go by fast. The three of you were absolutely amazing. And can I just say personally how encouraging it was to see you share so much of yourself. I know that because we do this work, sometimes we are reluctant to put that personal hat on. It's so easy to wear the professional one, but we thank you for putting that personal hat on and giving and sharing so much of yourself with us on today. And I just want to say that you helped me as well. I learned something new from you all. Every time we do this, I learn something new. And so know that it is so appreciated that you don't mind sharing yourself with the country. I have to be careful how I say that because I'm on the STD directors group, sharing your words of wisdom with the country. So again, thank you so much. And thank you to our audience who stayed with us this hour. We hope that we provided some words of wisdom and education and left you inspired to do more and to give more to the women that you serve. This includes our PrEP for Women having their say.
Thank you so much.
Thanks, everyone.